All right, everyone, we're going to get started. Welcome and thank you for attending the first Fourth Thursdays Lunch and Learn webinar for the new year. Please remember to hold your questions until the end of the presentation. We'll accept questions by phone and via chat. Also, if you are on the phone, we're going to mute the phone, but if you could please mute your phone as well to prevent any echoing. The Breast Health Collaborative of Texas would like everyone to know the information included in this webinar is intended as an educational resource and should not be used for diagnosing or treating a health problem as it is not a substitute for expert professional care. Additionally, the views expressed in this webinar are those of their authors and do not necessarily reflect the opinion or policy of the Breast Health Collaborative of Texas unless specifically stated. So now I would like to introduce our speaker. Let me mute the phone.
All callers are muted and they can unmute themselves.
So we have Tanya Hulett here. She's a representative with Juice Plus, and she will be presenting the MD Anderson Dietary Study for stage 2 through 4 cancer survivors.
Thank you, Ashley, for inviting me and giving me this opportunity. I'm going to tell you a little bit about myself and what my background is and why Juice Plus is important to me and why this study is important to everyone. So again, my name is Tanya Hulett. I have a bachelor's degree in science from biomedical. Let me take a deep breath. I have a BS in biomedical science from Texas A&M. I worked about 10 years in an animal emergency, and then I became a school teacher and taught science for 15 years. I'm a mother of 5. They range anywhere from 29 to 12. My youngest is 12, and I have 3 grandchildren. I started taking Juice Plus about 17 years ago, and it all started sometime after I graduated from college. And I was thinking back in my nutrition classes and what it meant to take soluble and insoluble vitamins and listen to a biochemist talk about the product. And that's what really got me interested in it, because I tend to be more of a naturalist. I would rather do things naturally for my health than take a bunch of medications and different things like that. So that's kind of what got me into Juice Plus. So let's look at some stats before we get started actually talking about the study. Here. Okay, so what do we know already? That 1 in 3 people live with some form of cardiovascular disease. 1 in 3 women develop cancer. 1 in 2 men develop cancer. 1 in 3 will develop some sort of diabetes by 2050. 1 in 3 are obese, and 116 million people are living with chronic pain. And the United States national health care expenditures are approaching $3 trillion a year, so it's all increasing. All this is increasing, so prevention should be one of those things that are top of your mindset. And we know that 75% of all chronic disease can actually be prevented. So let's talk about the Juice Plus company for just a second. Okay, Juice Plus motto is inspiring healthy living around the world. And our basic purpose is to go around to educate people on the power of fruits and vegetables. And what we feel like is that when we educate people on the power of fruits and vegetables, that this becomes a natural choice for them, the Juice Plus product, because of our busy lifestyles. So we provide a solution in order to get more fruits and vegetables into our diet every single day. Okay, so the MD Anderson Cancer Center. The objective today is to discuss the results of the actual study that they did with Juice Plus, and also to discuss a way that we can harness the power of fruits and vegetables in our current lifestyle. Now, I do want to say here before we get started that I do not consider myself an expert on nutrition by any ways or means. I've put this presentation actually together from a webinar that I heard with John Blair and Dr. Lovell Jones, which was the principal investigator. I also used some of the slides from Jan Roberto, who is a physician in Ohio, some Juice Plus slides from one of her presentations that I pulled in here. And I'm actually using some stuff straight off of the actual published research that was done in the Gynecologic Oncology. So that's where all the information has come from. If I don't know the answer to one of your questions, I'll try to find out for you, but again, I'm not an expert by any means. Okay, so the study was called a randomized parallel group dietary study for stage 2 through 4 ovarian cancer survivors. They actually shortened this to the one study, which stands for Ovarian Nutrition Education. And again, the principal investigator is Lovell A. Jones. He's a PhD that works out of the University of Texas, MD Anderson. His focus on his research projects is on women's health and also on minority health. And so this is where this project actually comes in. So why do the study? No studies have been done on the role of ovarian cancer. Let me have to switch my slide there. Why do the study? Okay, no studies had been done before on the role of diet in ovarian cancer survivors. So this was a first for ovarian cancer. Another reason is because the reoccurrence was really common. So they wanted to kind of pull that in somehow, and that we didn't know that, and that we already know that diets high in fruits and vegetables reduce the risk of many other cancers. So they wanted to look at the nutritional intervention, and they wanted to put Juice Plus in it. And it was an easy to actually, we'll go into this a little bit more because there's no juicing required. So when we look at the diets, we'll talk about that a little bit more. Okay, so let me give you a little bit of history on Lovell Jones and how the whole study kind of came about. The original motivation for the study came from the Women Health Eating and Living, the WELL diet, when they were doing that study. Someone from Juice Plus came to them and wanted to become part of it, but they were already way into the study and it was kind of too late to get into it. So they knew that and the WELL study was actually on prevention and on reoccurrence. What they wanted to do was to see if it would actually reduce it. And they were looking at the secondary primaries in breast cancer survivors. And so it was too late to kind of get started in it. So when we start talking about the WELL diet, I'll give you a little history on how that diet came about and how they started in with the breast cancer study. Aren't the fruits and vegetables beautiful? So we should have in our diet, bright colors and a whole rainbow. Okay, so the aim was to look at improved diet and improved quality of life. So the main endpoint for this study was improved quality of life. But Lovell really wanted to bring in, will it decrease or delay the reoccurrence of the ovarian cancer? So that was kind of a secondary thing that we'll talk about at the end, but wasn't the endpoint for the study. The study was quality of life. Did it improve quality of life? Okay, so let's look at the population. Okay, so this is the population. And so what they were trying to get was an age group between 50 and 59. And if you look, it shows you the two different groups and what they were. But they were looking for an age group between 50 and 59, somewhere around in there. They were looking at between stage 2 and stage 4 ovarian cancer. Most of them were in the stage 3. They were also looking at years from diagnosis, so they didn't want somebody that was just diagnosed. What they wanted was somebody that had been diagnosed and was past the 1.5, around in there, about a year and a half time group. And then they were white, and then they were looking with somebody that had greater than 25 of the body mass index. So they were looking at a bunch of different factors to get this group together. So that was the actual population. It took a long time to get these groups together because they couldn't promise anybody anything. They really didn't know what they would find with the study. So it took a long time because they couldn't promise them, really any positive effects. Okay, this study was actually a 6-month pilot, and it was a telephone study, which means they did a lot, and this is one of the limitations, they did a lot on their own. So they had clinical visits. They was in 3 stages, so every 2 months, every beginning of every stage, they would go in to do clinical visits, draw blood, different things like that. They did nutrition calls. The first stage they did them weekly, then they did them biweekly during the second stage, and then they did monthly calls after that. And then they had to fill out numerous nutrition forms, what they were eating, all kinds of data about what they were eating. And all that was submitted every 2 months for them to be able to go through and document so that they could see what they were actually eating. So let's look at the design study. It was randomized and it was comparative. There was no placebo group in here. So what they were doing was taking a diet they knew something about, the one that they did with breast cancer, and another diet they didn't know too much about, and they wanted to compare them to see if they had similar results. So the first group was a low-fat, high-fiber diet group, and they called it the whale diet, which is the Women's Healthy Eating and Living. That's the one that they did on the breast cancer. Mm-hmm. And this is where they had to have 10 servings of fresh fruits and vegetables preferably fresh fruits and vegetables every day. Okay, the second group, which they call the FVJC, which is the fruit vegetable juice concentrate group, they followed the National Cancer Institute diet of 5 servings of fruits and vegetables. And then we added in the Juice Plus Orchard and Garden Blend, which would be 2 capsules, and we'll talk about that in a minute, but which are capsules, they're not actually juice, and a complete protein drink. And so that was the difference between the 2 diets. Okay, so the whale diet. 2 cups of vegetable juice. This is what they had to have every day, preferably carrots because it's high in beta-carotene. 5 servings of vegetables, 1 dark leafy green, 1 yellow, and preferably all of them fresh. 3 servings of fruit, but 1 high in vitamin C, and then less than 20% of the calories needed to come from dietary fat, and then, greater than 20%, less than, and then greater than 30 grams of dietary fiber every day. And this was on average, knowing that you may not be able to get this every single day, but try to adhere to it as best as you can. And whatever you didn't do one day, try to make up for it in the next day, so we would have this average on a weekly basis of getting all of this into the diet. So let me tell you a little bit how this diet came about. When they did the research or started this first pilot on the whale diet, there was a caregiver to some cancer patients that had lung cancer. And she worked at the University of California in San Diego. And she also worked with I can't remember his name now, German peers who worked with smokers. So they did research on smokers. Well, she had developed this diet as being a caregiver for these cancer patients and saw some results. And so they got together and they put together a pilot program, which Sam Walton actually funded the pilot program because he had 2 children that were suffering from lung cancer. And so he funded the pilot program so they could get enough data to actually go to the National Cancer Institute to get the funding to actually do a study. But Walt didn't want it to be on lung cancer. He wanted it to focus on breast cancer. So that's why they didn't use lung cancer. And I don't know what the story behind that is, but that's why they didn't use it for lung cancer. They used it for breast cancer. And so that's how the whale diet came up. Okay, the second diet group, the fruit, vegetable, juice, capsule diet group, their requirements were they were going to do the National Cancer Institute, which was 5 servings or more fruits and vegetables. One of them needed to be high in vitamin C, and they needed to eat a variety of fruits and vegetables, not the same one all the time, but a variety. They would take 2 capsules each of the Juice Plus Orchard, which is our fruit blend, and then the Juice Plus Garden Blend, which is our vegetable blend. They'd have one Juice Plus complete protein drink, and then again they were going to have less than 20% of their calories from dietary fat and more than 30 grams of dietary fiber a day. And again, this was on average. So again, if you didn't do it one day, you tried to make it up on another day. So during that week, this would be an average of what you actually got in your diet. Okay, the hope, I do want to add in here, the hope with using the Juice Plus, because it is capsule form and that you do have the protein drink, that it would make it easier than trying to get a full 10 servings of fruits and vegetables. Most people about average, maybe about 2 to 3 a day. And so, you know, you're trying to force 10 a day, it makes it really hard, and to get that variety is hard. But if you have that variety already in a capsule, and all you have to do is stick it in your mouth and drink some water, or stick it in your complete drink and drink it down, it just makes it an easy choice. So let's look and see what Juice Plus actually is. So what is Juice Plus? This right here is our Juice Plus product. Oops. The two bottles, the red and the green cap, those are the ones that were actually used in the study. That is our orchard and our garden blend. And then we also have a vineyard blend. They did the study on the orchard and the garden blend because they already had research to back up some of the claims about what getting in, being bioavailable, getting into the blood system, stuff like that. So the purple top is not in the study, but I want to show you what's in all of them. Okay, so here is what is in the orchard blends. We have apples, and I'm going to say this wrong, acerero, cherries, oranges, pineapples, cranberries, papaya, and peach. In the garden blend, we have beets, tomatoes, spinach, broccoli, cabbage, parsley, carrots, kale, oat bran, and brown rice, and oat brown and brown rice bran. In the, I know it's kind of hard to see, but in the vineyard blend, which was not in the study, there's cranberries, elderberries, black currant, red currant, blueberries, blackberries, raspberries, bilberries, and Concord grapes. So imagine if you just look at the red and the green, getting all of that nutrition from all of those fruits and vegetables in your diet every single day in a capsule. Okay, let's look at the complete drink. The complete drink, okay, is gluten-free, low-fat, no cholesterol, no artificial flavors, colors, preservatives, no wheat, dairy, eggs, no caffeine, and it's kosher certified. This is our Juice Plus Complete, and we're actually going to look at it a little bit more in depth here. Okay, it is a proprietary blend. I need speech therapy. It has a protein blend in it, a sweetener blend, fiber, juice powders, and then we have some ancient blend grains, which you're seeing a lot more in the media right now. So protein. It's all plant-based. Okay, there's 13 grams of protein per serving. There's 5 sources. There's a low-processed soy protein. That's Raymond in the little picture. He's one of our soy farmers. It is water wash processed to increase the protein content. So we try to do as little as possible to the soy protein, and that's really important right there. We have the chickpea powder, we have the pea protein, rice protein, and the tofu powder. Now I know there's big questions about the whole controversy between soy, do we eat it, do we not, all that kind of stuff. They're finding studies out right now. There's one that came out 2009 that states that its soy food consumption was significantly associated with the decrease in the risk of death and reoccurrence. And then the Nutritional View in 2013 came out that it could possibly impede cancer progression. And then I found a couple of articles last night while I was looking at it. One of them was MD Anderson. It's on their website, published May 2013. It says, do soy foods increase cancer risk? And their pretty much view is no. You know, it doesn't mean go out there and eat a whole bunch of soy, because that's not what the issue is the little bit of soy that we can put on our diet could. But, and then the other one was the American Institute for Cancer Research. Their article called Soy is Safe for Breast Cancer Survivors. That was November of 2012. And that said that it was okay, that it would help decrease the risk. The thing that I remember from these two articles that I read last night, and I don't remember which one I read it in, but the big thing is the processing. If you can get the more natural forms of soy, then that's where you're going to decrease your risk. Yes, the soy has those factors for estrogen in it, but they also have the factors that the anti-estrogen factors in it. They both work together to kind of cancel each other out. You can kind of think of it. But I think, and this is my personal opinion, because I know this is very controversial, and I really am not the expert. But reading this, the first thought that I got was that if they're processing, what if that processed soy they're taking out, somehow it's damaging the anti-estrogen, and that's why some of the research we're coming up with high. Now, I don't know that that's a thing. That's just the first thing that popped into my mind being an analytic. So I would just say do some research, but the research is coming out that soy is not as bad as we thought it was in the beginning. Okay. Sweetener blend. Okay, we use organic cane juice and stevia. There are 8 grams of fiber in here, and it comes from the 7, I'm not going to read them all, but all the 7 sources right there. I think what's important to understand here is that not only do we have the insoluble fiber that we all need for gut health, but it also has the soluble fiber in there to help with sugar absorption in the bloodstream. There are 4 different juice powders in here: pumpkin, pomegranate, the spirulina, passiflora, however you say that, and the yucca powder. And then we have the 6 sources of the ancient grains, which we have the sprouts from broccoli, alfalfa, and radish. And then we have the 3 grains right here that you're seeing more and more in the news now. I don't know if you've noticed, but in the news, they're really starting to focus on health and health as a whole body, not just nutrition, but exercise, diet, and they're trying to bring the whole picture in. Juice Plus has been doing that for a long time. So what was actually measured in the study, and what did they find? Well, they measured blood serum levels, dietary intake, what were they actually eating and how much. The anthropometric indicators and medical characteristics, the first one that I listed, has to do more with, my slide, I don't miscall myself. Has to do more with weight, height, weight, waist and hip circumference, and then the medical characteristics with the age, the stage of the cancer that they were in, the race, and the data from their actual diagnosis. Then health-related quality of life, which was their endpoint that they really wanted to look at. They wanted to look at the physical and the emotional impact of substituting the Juice Plus for the other 5, how that would actually help impact, and then their whole diet, how that would impact them. So here are the results. So we're going to talk about some things that they found in the blood. Now, in all of these, pretty much there was no significant difference between both groups at baseline. So when they first went in and then took all of their baseline markers, really no significant difference. With the serum albumin here, it remained constant for the group 1, which was the well diet, but there was a significantly increase with participants in the group 2, which is the fruit and vegetable Juice Plus capsules in the complete. With the serum CA-125, really no significant difference from baseline up to 6 months. So there was really no change in that. This is what I like. I know this is really hard to see. On the left here, these right here are what each one of these are from the left to the right. Okay, because I know it's kind of hard to read. The first group here is group 1, and this group here is group 2. This is the Juice Plus group. So this is the well diet. This is the Juice Plus group. If you notice the line there on all of them, this is their baseline where they started when they came in at the beginning of the 6 months. And then this line here is the average where they ended at the end of the 6 months. If you look at these differences here, and I'm not going to go into each one of them and what they actually do, but my insight on this is that when you look at these and you look at the dots where they plotted them, you notice the line on all of them are pretty much increased, except for here. It stayed pretty much at baseline, maybe a little bit below. And then here for this group, it was below baseline for their retinol. But the other thing that I find interesting about this, looking at this, is that if you look at the grouping of the dots on most of them, if you look at the Juice Plus people side, they're all grouped together. So that's it looks like they're having more consistent, to me, like they're having more consistent results than at group 1, the well diet, where it's kind of spread out over. And I don't know, it's my thought that this occurs because they're getting the same amount of fruits and vegetables in those capsules every single day, which makes it a more consistent diet. Whereas the well group, they have to go out and find and forage and do their own fruits and vegetables. And so that makes it a little bit harder. So I think that right there is kind of significant. And the fact, even though they really don't mention anything about it, I just think that that's really significant, that there's more grouping together in a lot of the data points there. Okay. The other thing to notice too is that there is a significant difference in the beta carotene right here with the groups, and they believe that because of the studies that they've done before on Juice Plus, not related to cancer, that the beta carotenes were increased with it, but that's the reason. They already knew that they probably would find that in the study. Okay, quality of life. I try to think about what the best way to present this is. When you listen to Dr. Jones talk about this, so they're not a big significant difference between the two groups. But if you start looking at, we have the well diet up here, group 1, and then the Juice Plus group down here. If you look at the increases and what the mean increase is here, you can see that if we totaled up all of the increases for the Juice Plus, there was a significant increase as far as their changes from where they started at baseline here to where they ended up at the end of the 6 months. Not real significant by, I don't think, statistical standards, but that is significant there. And I don't think they really expected to find that when they were actually comparing the two diet groups. So I think that's really important. So quality of life did increase because if you get more nutrition, you feel better. And if you feel better, you start doing more things for yourself. You start exercising more, drinking more water, all that kind of stuff. So quality of life did. So as far as the result, their endpoint, that yes, both diets did have an effect on quality of life. Here is the dietary intake. I'm not going to spend a whole lot of time on here. Said about an average, about 9 servings of fruits and vegetables a day is what everybody was getting. The percent fat intake and the percent fiber wasn't where they really wanted it, but pretty far as increases. I mean, if you look here, they started out on average about 20.8 and got up to 26, so that is an increase. That's pretty good. With the Juice Plus, they started out at 20, ended up 23.4, so they both actually increased their fiber intake, which is good. So they just give you an idea there of comparing the two groups, how much they increased or decreased in their diets. Okay, so there's lots of discussion on what actually, lots of discussion about the actual research after it went on. And part of it was that they did realize that a healthy diet supplemented with the encapsulated food, fruits and vegetable juice, the Juice Plus capsules, and the soy-based beverages was actually safe and feasible for women with ovarian cancer. They also found, looking at some of the statistics, that older women whose serum albumin levels exceeded the 3.7 grams per deciliters experienced about a 40% reduction in mortality rate. They had, within a 5-year period, I think, they had 4 of the participants that actually died of it. And so what they're going to do now, because of the results that they found, they've tracked it 5 years. They're going to go back, and the women that actually could do the study but opted out of it, they're going to go back and track them and compare it to these two groups when they're going to do what they call a chart study to see if really what the effect might be as far as the reduction of reoccurrence in mortality in ovarian cancer. So this study is leading to another study. I don't know if they've started yet, but this is something that Dr. Jones talked about on his webinar, that it was something that they really wanted to do. Now, again, there are some limitations. This was a small sample size. There were only 51 women in there, and at the end of the study, there was 40 total. It was a small amount of time. They only tracked it over 6 months. The fact that they were having to self-report their measures, that is another limitation. Poor adherence to the intake of the dietary fiber and the fat recommendations, that they didn't really get it where they wanted it to be, and the fact that it wasn't a placebo-controlled conditions. Those are some limitations to the study. But if you're already studying a proven diet to another diet, you know, they can both benefit from that. It would be hard to get a lot of people to come into a blind placebo study with this, knowing that they may not get any benefit at all. At least here, there's that possibility, although they did not promise anything to anybody because they really didn't know what would happen with the Juice Plus study. So they were surprised. Okay, so conclusion. So the conclusion is that it is safe and feasible for stages 2 through 4 ovarian cancer survivors. It did complement the NCI diet of 5 fruits and vegetables a day, and that in the report they say it may increase phytonutrients in ovarian cancer societies. Of course, they have to put that in there because they can't make big claims. That came right out of the actual published study, that it may increase the phytonutrients in ovarian cancer survivors. Okay, so why Juice Plus? Well, Juice Plus is smart and easy. All 3 of those bottles up there to get the daily dose is only $2.38 a day. That's it. You can't go out and buy fresh, organically, vine ripened, juiced within 24 to 48 hours, you know, dehydrated, take the sugar out, all that kind of stuff. You can't do that for $2.38 a day today. And to get that variety, it just cannot be done. If you're doing it, that must be all you're doing, because I grow a garden and I can't do that. The Juice Plus Complete is healthy. It's the healthy fast food. Put your stuff in there, shake it. This morning I had a complete shake. I just put the chocolate powder in there, some almond milk, shook it up, drank it, out the door I went. $2.05 a day or serving. You know, it's fast, it's easy, and you're getting, if you take all of those, over 49 different whole food, nutritionally dense, all of that in your diet every single day. I get excited and then I can't talk. Okay, so micronutrition. Okay, so the Juice Plus capsule gives us the micronutrition, all those phytonutrients, the vitamins, the minerals, the enzymes that we need to actually build, repair, and protect our body. The macronutrients, which is the food for our body, our fuel, that is our proteins, carbohydrates, and fat. That's where we're getting that. I also want to point out that Juice Plus is whole food nutrition. It actually carries a nutrition label. It does not carry a supplement label. In the state of Texas, we don't get taxed on food, so when it's shipped to us, we do not get taxed because it is considered a food. It is not considered a supplement. It is, you know, they try organically grown, no pesticides, herbicides, non-GMO. It's all of everything that we would want to put in our body every single day. There's only 5 calories in the capsules. Okay. Again, here is the label for the complete drink. It's 120 calories per serving. We get 0.5 grams of fat per serving. There are 8 grams of dietary fiber and 13 grams of protein. Okay, why do I like Juice Plus? And when it first came into it, we didn't have very much research 17 years ago. But the company's been around for 20 years, and we have lots of research. It's evidence-based and clinically proven to do the things that it says that it does. We have 31 different published research done over 20 years. 75% of them are double-blind, placebo-controlled research. Over 2,000 participants in these research, different research projects, and they were all done by major universities around the world, not just MD Anderson, Wake University. I can't think of them right now. Yeah, Germany has done some, Austria has done some. They're just all over the world, and we're talking about major universities. And these are all the published, most of the published. There's a couple of them that are covered up over here. So what does the research tell us? It tells us it delivers nutrients that are absorbed, so it's bioavailable. It reduces oxidative stress. It supports the immune system. People who take Juice Plus have improved inflammatory markers. It helps protect the DNA. It supports cardiovascular wellness. It promotes healthy skin and gums. Improves the quality of life in cancer survivors, and that's what they found with the MD Anderson pilot. Reduces insulin resistance in children, and improves pulmonary function in smokers. So this is kind of a summary of everything that they've done over the last 20 years with the research. And again, this is Juice Plus. We inspire healthy living around the world. We do have the Juice Plus capsules and gummy forms for kids too, so it is kid friendly. And then we also have products where you can grow your own kale and spinach and different things like that to put in smoothies or too, so that you can get the best product, the best fruits and vegetables that you can get. Okay, here's my contact information. I'll leave this up. Again, my name is Tanya. That's my phone number. It's a cell phone number. I welcome you to call or text, or if I don't answer, just leave me a message. My email is up there. You can email me. My website's there. It's fruitandveggiesolution.com. It has all kinds of information on there about the product and where it's grown. You can search the internet if you search MD Anderson Juice Plus study, you will actually come up with another webinar where John Blair, a representative from our company, and Mr. Lovell Jones, where they talk to each other about the results of the research and where it's actually going to go. And I believe that's the actual website there you can actually go to find that study. But if you just do MD Anderson Juice Plus study, you'll find that out. I guess I really enjoyed this. This is the first for me to do a webinar, so I'm a little bit nervous, and I tend to talk too fast, but this has been fun. I just want to thank Ashley for inviting me, and if there are any questions, I'll try to answer them. If not, I'll get back with you.
Yes, I'm going to unmute the phone.
All callers are muted. All callers are unmuted.
So if there are any questions by anyone on the phone or on the web, please do go ahead. Or any questions in the room? Okay. And repeat them.
Thank you. From which groups, did the women die? You said.
Well, they only talked about what I know of that there were 4, but it didn't say which groups that they were in.
For me, it's important as a survivor because.
Right. I think they had the combination because the Juice Plus group was 40%, like I put up there. They had 40%. I'll find that for you. Just the 40%, and then it was 30% for the other group. So they had a higher survival rate.
Then was the control group, or why was the control group used? They were on a diet that were using fruits and vegetables that they recommended FDA and CI, and then you added on Juice Plus.
Okay.
Now let me.
Okay.
So I work with people who are very pessimistic. They'll say, "Hey, how do I know it was not the 5 and the recommended nutrition, the recommended fruits and vegetables, not Juice Plus?" You work with people who are going to challenge you. How do I explain that?
The only way that I can really address this is that the first group was 10 servings of fruits and vegetables. Okay. The second group was 5 servings of fruits and vegetables and the Juice Plus. Okay. So what they were trying to do was to substitute the 5
with the
Juice Plus, and what that would do, because it's easier to take the capsules, drink a protein drink, than it is to find 5 more fruits and vegetables.
That's
to take in. Yeah.
Yes.
And so someone has asked online, what is the cost of Juice Plus?
It is, and they just raised the price. For all three products at the top, it's $71.25, somewhere around there. Yeah, my mom's gonna grab one of her. They just upped the prices in January, and I've got it. They went up by 6%. It was $61.75 per month for all three of the vineyard, for the fruits, the vegetables, and the berries. And then the complete is about $27 a month for complete, and everything went up 6%. And this doesn't happen very often. This is the second time we've had a price increase since we started.
Another question, was this study only with ovarian cancer survivors?
Yes, didn't want to add. You don't want, when you're doing a study, this is why it becomes very specific. You don't want to add in too many variables. That's why they tried to keep within a certain range, so much time out of treatment, and also they stayed within, they were all white women.
Mm-hmm.
So you don't want to add too many variables, because then you start adding in other things too. So try to keep it down as much as you can when you do research.
Any other questions? Anyone on the phone or any online? Leave it open for another minute or so.
Fantastic. Excellent.
Hey, Ashley?
Yes.
Can you hear me?
Yes.
Good afternoon. This is Jenny.
Hi, Jenny.
Hey, just a comment, really.
Uh-huh.
I'm delighted to hear some information and to see a presentation on nutrition.
Mm-hmm.
I think that, of course, this is long overdue, and
Yes.
it's really nice to see MD Anderson exploring this. And I know personally in our family, my mother's had great experience with Juice Plus,
Oh,
having been a
definitely.
colon cancer survivor and not being able to eat fruits and veggies. She's been able to supplement and remain cancer-free for, I want to say, more than 15 years
Oh,
now.
that's fantastic.
So just no more than a comment. We think of fighting cancer on so many different levels, and we still don't have cures for some. But when we think of treating cancer and putting a lot of poisons in our body that can fight malignancies and the growth, we often don't hear a lot about healthy eating and
Yes.
nutrition, which to me is got to be part of the solution. So thank you for inviting them and for opening up the dialogue. It's one that'll be around a long time, and I'm hopeful it will be explored and funded through research, but that we can encourage women in our community to not only keep their appointments and to oblige by their doctor's orders, but to complement their recovery with good healthy habits like
Right.
these. So just
Right.
a comment. Thank
Thank you so
Thank
much
you.
for sharing. That I did not know that. Thank you. Are there any more questions, comments? Would someone here would like to share?
Yes, I've been on Juice Plus for 20 years. I was at the grand opening the first time they brought it in. And over the years, a lot of my friends have put on additional pounds. But guess who's looking hot to trot? That would be me. I used to be several sizes larger than I am. And all I've done is stay with the Juice Plus, all three of the capsules. And every night, dinner is a treat because my husband cooks dinner. And what's for dinner? Juice Plus Complete. Yes.
Okay.
So that's been, my personal experience. And I wouldn't trade it for anything. Personally, I would cut the phone off, internet, before I would give up my Juice Plus.
Same here.
Okay. Wow.
And that's
Wow.
after 20 years.
Wow.
So she was worth bringing.
Yeah.
No, she brought me into this.
Well, if there are no other questions, just want to say thank you, Tanya, for
Thank you,
the
Ashley.
very informative presentation. We really appreciate it. I also want to thank our wonderful program committee for always organizing our webinars. We really appreciate all the work that they do. Our next free webinar will be February 27th, and we are still working on finalizing the topic as well as the speaker. So if you'll just check our website, www.bhctx.org, then you'll see there where you can register and what the speaker and topic will be. It actually looks like we have one more question. And I'll just throw it in really quick before I conclude. Have there been any studies with women of color?
Yes, Dr. Lovell Jones actually did one on African Americans. So in Juice Plus, and it was a very positive
Awesome.
results in it. Awesome.
Okay. Well, thank you. That will conclude our webinar. We really appreciate everyone attending and their time and their participation. And
Yeah, thank you.
hope you all have a really great day.